And joining us now, Dr. Catherine Phillippi, Pediatrician with TrustCare. Appreciate you coming in, Doctor.
Thank you.
All right, so we were just talking before we came on here about the recent update to the CDC's guidance with respect to COVID vaccinations for very young people. Give us the skinny there.
So they did approve the emergent use of vaccine down to age 6 months. So prior to that decision, we were able to vaccinate down to age 5. And now the studies have shown that not only is it safe, but also there's an effective plan to get 6 months and up immunized against COVID.
Who makes vaccines that have been approved for that age group?
Moderna and Pfizer have both been approved, and their studies are, both equally as effective, but have different routes through which you immunize. So Moderna's idea was to have less injections and a quicker time in order to get people vaccinated in a shorter amount of time. So their dose is a little higher dose, but you get 2 doses.
I got you.
Then Pfizer was really fearful that if there were side effects to the vaccine, word of mouth would deter people from coming back and getting boosted or not coming at all. So they chose a much lower dose, and you get it over 3 shots, which prolongs your, getting the child fully vaccinated,
Sure.
But you have less side effects.
Have you given any thus far?
I have not. It's not, we have not been able to order it yet.
Okay.
Apparently it's on go and at the health department, and today we were going to hopefully get our order in and receive supply soon.
I got you. What would you tell your patients?
So I definitely think it's a hard topic. People have really mixed emotions, and we all have COVID fatigue, and it's easier to not say anything and just hope that they figure it out on their own. But I am encouraged by this being out in the news. That's why I'm here today, because I want people to hear me say that if I had a 6-month-old, I would immunize them. I have teenagers and I've immunized them, but I'm definitely seeing, a wide range of reception to the vaccine. And what overall, the overarching theme is when someone is intimately affected by a serious consequence of COVID, everyone in the family comes and gets the vaccine. And so no one says, I wish I had not gotten the vaccine in that situation. So we do know that initially in the first year of COVID, kids were not affected as much, so we weren't as worried. But with this Omicron variant, and it's changing radically different variants of that particular strain, and it seems to have more, deleterious effects to children and long-term consequences. So we're hopeful that this vaccine will prevent that.
Have you treated young people in that age group for COVID?
Yes, definitely. And have had several in the hospital, several in the ICU over the past 2.5 years. Now, of late, the last few weeks, we have seen a rise in the amount of not only people coming in to be tested, but also how many positives. Lots of daycare settings with kids under 5 who one in the classroom gets tested, and then you realize several are out with fever and they haven't gone to the doctor because they're just starting with symptoms. And then we'll end up having the whole class come for tests. And, I had a half of a class last week that was tested positive under a year of age. So those stories are becoming more common over the last 1.5 to 2 weeks.
To those who would express an objection to vaccinating their children in particular on the basis that we just don't have enough time, experience in testing and
Sure.
determining if there's any sort of downstream negative impacts, and they have concerns about that, or others that may just say, the chances of a child of getting infected are fairly low and getting seriously ill are lower, certainly than adults. What do you say to them?
So I'm compassionate because I didn't grow up in a medical family, and until I went to medical school, a lot of those things I was a skeptic of, and I didn't understand the microbiology behind. And what I know is that these vaccines have been studied under other circumstances for decades. So this isn't a brand new technology. It is new to the COVID virus, but we know that messenger RNA vaccines have been around for a very long time. We also know that, for pediatricians in general, we want to prevent illness like none other. Yes, we talk about obesity and diabetes and all the things our state needs prevention for, but in children, we really want to prevent disease. So I always tell my patients, I'm like, I think that vaccines are just as important as washing your hands, wearing your seatbelt. You wouldn't go get a vaccine. You wouldn't buckle yourself up and not put your child in a car seat. So if you're buckling, you're likely also, and even if you choose not to buckle, you're likely putting your car seat appropriately buckled with your child in it. And so I'm hopeful that people will hear that message over and over, and with time become more and more confident in the healthcare professionals that are vocal about this.
Have you, in your practice, have you seen any patients who have had some sort of negative reaction to the vaccine that you've had to treat?
Other than fever or local irritation, just like we would with any vaccine, no. And actually, if you look at the studies for Moderna and Pfizer in 6 months to 4 and 5 years old, the placebo arm had more fever in the Pfizer trial than the actual vaccine arm. So I do think that, children have fever for lots of random reasons, sure, unrelated to a vaccine. And fever is not scary. Fever is your body saying, I can fight this, whether you are sick with something or not. So I spend a lot of my day explaining to people that fever is a good phenomenon. Now, yes, we like to make people more comfortable. We like to know why there's a fever, but fever itself is your body doing what it's supposed to do.
Yeah. So when you see some of these reports, there's a lot of folks that seem like they just want to find bad results and negative reactions to the vaccines because they don't believe in vaccines, or certainly this vaccine. What do you say to them? They seem to dig out all kinds of, are these outlier cases, or are these?
Definitely, I think with information overload that our entire culture has, you can find something to support your hypothesis. But in Jackson, Mississippi, in my clinic, I have not had anyone that would say, I'm never getting another dose. Now, I have had people say, gosh, I had fever, so I'm not going to take it the day before I have to take the ACT, or, something important, and I'm going to take it on a Saturday when I have nothing to do. But I don't see any super, I guess, reputable side effect that you would read about in, glamorized situations. I do think that if you are afraid of COVID, you have to know that there are ways. I've had COVID twice, and I've had 3 vaccines, but I'm here talking to you. I've never been in the hospital. I have not been, I have no long-term consequence, but I have patients in my practice who are kids who have long-term consequences, who are, followed up by cardiology for heart risk. There was some data that said that vaccine increased your risk of myocarditis, which is an inflammation of the heart muscle. But what we know is your risk of myocarditis from the actual live infection is higher than that of the vaccine.
Gotcha.
And the myocarditis caused by live infection is incredibly worse than any myocarditis that resolves on its own from the vaccine. So that fear is unsubstantiated. And I have had myocarditis in my practice in patients who got COVID. And they are very sick at the time. And we don't know what their heart will look like in 25 years.
What about the general sentiment, the attitude about COVID vaccines from your colleagues, from within the medical community?
I think there's a lot of still politicized views, whether you lean more to the right or to the left. I think in medicine, we can't let that sway us. I think that we have to be wise and good stewards of the science. And so I fear that my colleagues are are swayed by that sometimes, or fearful. I don't think it's because they want to be political. I think they may be genuinely fearful, but I'm not.
Gotcha. Dr. Catherine Phillippi has been our guest here. She's a pediatrician with TrustCare Kids. Appreciate you coming in, Doctor.
Sure.
Yeah. We'll take a break right here on Middays. We'll come right back. Stay with us.